Hey guys, how's it going? A real quick discussion about cause of death after a heart attack. Somebody's having a heart attack when you call 911. In fact, don't be driving to the emergency room in your own vehicle. Don't do that. Call 911 when there are serious heart attack symptoms, and then they quickly come, give you aspirin and all that. Quickly get the EKG done. Quickly draw your blood sample to see troponin. And within heart attack, there are two kinds: NSTEMI and then STEMI. STEMI means ST elevation heart attack, and that can damage your heart muscle real quickly. And then NSTEMI is a different kind. We'll talk about that later. But within STEMI, which means ST elevation heart attack, the pump can fail because it's not getting enough blood supply. Because there's a clot or there's a cholesterol plaque that's ruptured, and then they have to quickly take you to cath lab and put a stent. Once they put the stent, everything it gets fixed up real quickly. So there's a clear treatment protocol, but if that didn't happen, people can die. And when they die, it could be because of several other reasons, of course, but two, I'm going to discuss about two. The first one is electrical activity, because each of the cardiac muscle, it's called as cardiac myocyte. They have excitability and they have the capacity to just beat on their own, develop electricity. But normally, the heart beats with a clear, discipline, because there is a master orchestrator called a sinus node, and then it develops the electrical impulse for the whole heart to beat, and then it goes from sinus node to AV node down to the ventricles. But then when there's a heart attack, this electrical circuit gets disrupted. Then you can end up with a chaotic beating like ventricle fibrillation, where it's beating 300, 400 times a minute. And then that's not good enough to pump blood out of the heart. So it just beats like that for a few minutes, and then it just goes into asystole. Asystole means the heart just stops. So that's because of an electrical problem. Okay, and then the second thing is because of a pump problem. Normally the heart should be able to pump 60% of the blood out of the left ventricle. That's normal pump function. Instead of 60%, it may just pump 30% suddenly. So then what happens is blood from the right chambers end up going into your lungs, but when they come out of the lungs into the left chambers, the ventricle is not able to pump it out. So all the blood gets backed up in the lungs, and then the lungs can't handle it. Then there's just too much blood inside the lungs, and then you go into pulmonary edema, which means the lungs are now filling up with fluid, and then people die from that because you're not able to pull enough oxygen. So these are two reasons: electrical activity like VFib, ventricular fibrillation arrest, or pump failure, which means you get into acute pulmonary edema, and that causes death. So this is just in a nutshell. I'll talk to you later in my next post, guys. Goodbye.